Abdullah, our pediatric consultant. She's a professor of pediatrics in Cairo University. Welcome to Wafaa.
السلام عليكم ورحمة الله وبركاته. Good morning, everyone. I want to thank the committee for giving me the opportunity to meet you today to talk about a very important subject which is running in the mind of all of us, not only pediatricians, which is COVID-19, new generation and variants, especially Omicron. Let us start. Here is a page of the references. I always start with this slide because it is the most important one, containing the CDC website and the WHO and UNICEF websites. By the way, children are affected from the first day, from the very, very beginning of the epidemic, not only from just few days ago when Omicron started, because what's called ACE score. ACE score is a score concerned with the abuse and neglect of children, which is very, very high during the epidemic. The current immunological characteristic of COVID-19 in children are infected mainly through contact with those infected others. The virus is mainly spreading through respiratory droplets and close contacts. Most children with COVID-19 can excrete the virus through fecal matter because the virus entrance is mainly through the gastrointestinal tract, not like adults. Also, through the aerosol or contact with body fluid, and unfortunately, they found the water waste containing the virus, which means the virus can be transmitted through water. Starting from the newborn period, together with children of all ages are likely to be infected with COVID-19. By the way, these are the sizes of the PM, particulate matter. Our masks are only preventing this one. You know where is coronavirus? We have to wear a mask of this size, which can filtrate this one. And most of our masks, which with our clothes are the disposable one, can filtrate up to this size. Good news, right? Huh? Sure. This is the RBC size, this is the bacterial size, then the Omicron. So, during the last period, the Delta wave kids were the leaders. We started to know the diagnosis of Delta virus in children. We were the leaders. But in the Omicron period, we are in the middle of the pack. As you see here, here is in January. Before, that was the amplitude of the reported cases in the United States. Here are the number of admission of cases from 0 to 17. And as you see here, in January 2022, we started to be very high, skyrocketing. And here are the pediatric age group in the middle of other ages. As you see here, we are much increasing in size. We know now there are many variants. We have the Alpha, which was discovered first time in New England, and the Beta type, which was in South Africa, the Gamma type, which was started, I think, in Brazil, and Delta type, which started in, this one is India, and the Omicron, our famous invader nowadays. So SARS-CoV variant story has to be known. Why a virus is making a mutation? Because of continuous pressure exerted through vaccination of many people, and at the same time infection spreading through the population. This will lead to pressure, and pressure will continue new configuration and new mutation and so on. So the mutation is a mutation refers to a single change in a virus genome. And a lineage is a group of closely related viruses with a common ancestor. And the variant or viral genome containing one or more mutation which will spread. We have many types of this variant, what is called VOC, which is the most important variant of concern. We are concerned with what is going on. There are two variants. We will know which variants are known to be VOC, and the variant of interest. When the virus will be just outbreaks like influenza, it will be VOI. And variant being monitored, this is most of the variances. Its name is VBM, variant being monitored. We have 9 variants, we will see the next slide. And the variant of high consequence, or VOHC. I hope we will never develop this type of variant, because this type of variant means no treatment, no diagnosis, and no control. Here are the اليونانية اللي هي alphabetical order. We have the alpha, beta, gamma, epsilon, zeta, eta, lota, kappa, and mu. About 9 variants are well known, but they are not that important. Which one is important is the Delta and Omicron. You know why we skipped these two? Mu and Kizai, its name is Kizai, right? Because Zai is a known name in Chinese language, if someone is Chinese here. That's why they started to avoid this name. And Mu means something new, and the virus is not new. That's why they skipped to number 15 of the alphabetical order of the Greek language, which is Omicron. Omicron designated a variant of concern, VOC, as we have seen before. On 26th of November, WHO designated a variant of concern, which is Omicron. Omicron has a large number of mutations, not only 30, that was at the beginning of the epidemic, more than 50 are discovered now. The spike protein of SARS-CoV-2 is started by some of the currently approved COVID-19 vaccines. Mutations in the spike protein therefore need to be closely monitored. Some mutations have previously been associated with increasing transmissibility and making it easier for the virus to bind and attach to cells. At the beginning of the epidemic, they tried to discover more about this virus. They found that transmissibility is more, reinfection of the previously infected corona victims. Maybe they have good hospitality for the virus, that's why they decided to go there again. So patients with previous coronavirus infection are easy victims and targets for new Omicron infection. And the detection, and I want to stress and shed light on this part, which is detection of Omicron. At the beginning, they thought the PCR of ordinary coronavirus can detect Omicron. And I think you agree with me that this is not true. Not all Omicron mutations can be discovered even by PCR. I'm not talking about the lateral flow or what is called rapid antigen test. I'm talking about the PCR test. That's why the what's called European Commission's Joint Research are releasing a new test, PCR test, specific for Omicron. It will be in the market soon. And about the clinical management, they think still corticosteroids and interleukin-6 receptor blockers can improve the cases. While characteristics of Omicron are being studied, evidence shows that COVID-19 vaccines are still effective, but if you receive the 3 doses, not 1, not 2, the 3 doses must be taken. What are the risk factors which predispose our children to be affected? We have the food insecurity, domestic violence, children's homeschooling, المنصة. Children's homeschooling is very important part. That's why the American Academy of Pediatrics announced it. Under any condition or epidemic, don't keep children to study at home. Socialization is very important. Parental responsibilities, children's social interaction, children's screen time, COVID-19, household infection, financial concern, and stress. What will improve the resistance of our children to this virus is the activity of daily living, eligibility for provincial and national assistance, child care, resilience, and maternal relationship satisfaction. There are certain diseases which can affect the general immunity of the child, especially diabetes type 2, asthma, neuropsychiatric disorders, and essential hypertension and epilepsy, and also Down syndrome. Now, why the children were not the primary victims of the virus? There are 5 clues which protected the children to be the first victim at the beginning of the epidemic. The first one is the ACE2, which is angiotensin converting enzyme 2. We have 2, 3, maybe 5. يعني دكتور سيد ممكن يصلح لي. We have about 5 types of ACE. This is number 2, which is opposing the function of ACE1, and it's very important homologue of the stability and the very important in invasion of the cells and many other factors. So ACE2, which is considered here a spy inside our cells, which was welcoming the virus. Whenever the virus is coming, he is searching for his spy inside our body. The enzyme is this spy. When it is available, the virus is safe. So ACE2 receptor is reduced in the respiratory tract of children. Coronavirus associated with common cold, which is considered protective for children. كل مناخيرهم على طول نازلة. T helper cell immune response are very active in children, whether in the respiratory tract or gastrointestinal tract. Also, eosinophilia is very protective in case of coronavirus. Children generally produce lower levels of inflammatory cytokines. All of you know that the cytokine storm, or what is happening in our body on invasion of coronavirus, is due to our response to the virus, not the virus itself. So if our immune system is calm, nothing will happen. But if it is overreacting, then all diseases will happen. Here are the pathogenesis and what happened from this spy. This spy recruited another spy in our body, which is the transmembrane protein RSS2. This type of protein is another spy which helps the ACE2 receptors in welcoming the virus, and unfortunately it is available in the respiratory tract of our children. You know what is the value of this transmembrane protein? Blocking of this transmembrane protein will lead in the function of many mucolytic medications we are using, especially bisulfone and mucopront, bromohexine and N-acetylcysteine. That's why when they discovered that, they started to insert mucolytic as a part of the regimen in treatment of coronavirus in children, early coronavirus. These are the symptoms: fever, cough, respiratory distress, fatigue, body aches, headache, and many others, and you know them very well. But what are the characteristics which are specific for children? We have the abdominal pain, vomiting, diarrhea, as you see here. Gastrointestinal tract is involved. Here is a comparison between the common manifestations coming with fever, malaise, coughing, blocked nose, and respiratory distress, and how to differentiate between them, and how to diagnose through laboratory investigations. I want to stress on one point here. White blood cell at the beginning of the disease, or if the disease is mild, white blood cell will be low. When the disease is aggravated, it will be increasing. And neutrophils will decrease, and when the disease is severe, it will increase. Lymphocytes decrease, neutrophils and lymphocytes are decreasing, so white blood cell count, what will increase is the monocytes. Monocytes, the normal value of monocytes, how much? About 8%, it will be 15, 20, 30, which is an early sign of invasion by coronavirus. Hemoglobin will increase because of hemoconcentration, and the platelets may or may not increase. Biochemical reaction, we have the AS2, liver function will increase with decreased creatinine. Maybe because of anorexia, you are not eating proteins. Inflammatory coagulation, the CK will increase, LDH, CRP, ESR, and I'm astonished to know that procalcitonin will be high. What about the late part of disease? What are the changes we are expecting if we find the following investigations? Leukocytes will be high, lymphocytes will decrease more, neutrophils will be high, and eosinophils. So presence of high eosinophils is a good sign for protection, and in severe cases, eosinophils will be low. The neutrophil to leukocyte ratio will increase for sure, and biochemical parameters, the LDH, CRP, PCT, and ACT will be high. What is CTNL? Its name is cardiotropin. It's for functions of the heart. And interleukin 6, interleukin 1B, and KL6. What is KL6? KL6 is one of the products of damaging our pneumocytes. If the pneumocytes is damaged, this one will be released. So its increased level means beginning damage of pneumocytes. And also high ferritin. Coagulations, platelet count will decrease, the diameter increase, fibrinogen increase, PT and APTT. What about the imaging manifestations we are expecting to see in such patients? CT is used for screening, but that in adults. Till now, I know, in Kasr Al-Aini, till now, they are admitting patients after a screening test with CT. But the best imaging study for children is the lung ultrasound. There are certain criteria to diagnose early coronavirus infection in children. I think these criteria are beyond the scope of this lecture, but it is more sensitive than CT for screening tests, and sometimes it gives false negative results, very accurate. Bronchial wall thickening and peribronchial opacity, and I know you know very well what is called halo sign. Halo sign is an area of consolidation, like a ring surrounded by ground glass appearance. This is very characteristic for like the one here and the one here. This one is called reversed halo sign, where there is consolidation surround the ground glass. What about the treatment of COVID in children? We have the antiviral treatment, but unfortunately it is for the age above 12 years of age and weight above 40 kilograms. COVID-19 monoclonal antibodies, unfortunately, it is not effective in children. Other drugs including chloroquine, hydroxychloroquine, azithromycin, and others, they are not effective like before. And the anti-IgE have passed the phase 2 trials, maybe very soon will be in the market for the use of treatment of coronavirus invasion. And the traditional Chinese medicine, and it is not a joke. Yoga is a part of coronavirus protection. And some herbals are also used. That's why the traditional Chinese medicine is the one which is used in China now, not our medications. What about the adjunct treatment or adjuvant treatment for coronavirus? We have the vitamin C, which will control inflammation and protect the mucous membrane. Vitamin D, which improves the immune response. Whenever you have a child with coronavirus, please think of these multivitamins, please. Folic acid, which will help vitamin D, and zinc, which impairs virus RNA replication, and bromohexine. As I mentioned before, it is one of the new regimen for protection or reversal of the inflammation and coronavirus infection. Also, bromohexine through the inhibition of the second spike NPRSS2 and also an N-acetylcysteine. And the last one is the androgen inhibitors. Maybe is not a likely regimen in adults, but it is used in children. Multi-system inflammatory syndrome, it is a whole subject beyond the scope of this lecture, but it is the leading cause of admission of children to the hospital. And I think we have treated 3 or 4 during the epidemic. These are the manifestations. And now I want to shift to a very important part in our practice, which is the post-COVID syndrome. COVID infection is not simply just few days of fever, maybe cough, maybe loss of smell and taste, and that's it. No, sometimes it persists. 1 to 2 children, every 10 children infected with corona, whether symptomatized or not, will have these symptoms. What is called post-COVID syndrome. We have the acute COVID, up to 4 weeks of age if he is symptomatizing, and long COVID if the symptoms continue beyond 4 weeks of age. We have 2 types. The ongoing symptoms for the first 3 months, its name is ongoing symptoms, and if it continues beyond 3 months after infection, its name is post-COVID syndrome, and this is very important. And now, if a child is proved by 2 or 3 doctors confirming that he has a post-COVID syndrome, this report must be submitted to his school so he can skip the exam. Because he has fog mind, he is stupid, he is not intelligent like before. Who gets long COVID? What are the predisposing factors? We have the increasing age, excess weight and obesity, female gender, unfortunately, asthma, multiple symptoms at presentation. A patient may not have had a positive COVID test. This is very important. And the children. Why does this occur? Potentially due to the body immune response to infection. No more virus in the body, but the remnants of the fighting between our immune system and the virus. The remnants will cause some sort of subacute continuous inflammation of our immune system. This is the target for the development of the post-COVID syndrome. That's why the vaccination is said to be the only cure for post-COVID, because it will pick the remnants and get rid of them. These are some of the symptoms. The most important of them is fatigue, malaise, lack of concentration, fog mind, and the patient most of the time lazy and tired. Something like chronic fatigue syndrome after infectious mononucleosis and herpes infection. Also, fever studies looking the exact risk in children. As you see here, the one which is up to 100% of the cases of long COVID is the fatigue, sometimes the anosmia and headache. If you want to see this graph better. This is the investigations I can see in long COVID syndrome, and as you see here, the long COVID syndrome, the PCR test is negative. What about the vaccine? This is a very important part I want to mention. There is what is called vaccine hesitancy for adults. What about children? Maybe I answer more than 100 questions per day through the patients, through phone calls, WhatsApp, social media, everywhere. They are asking us, Doctora, if this is your son, you are going to vaccinate or not? Helena listens to what I'm saying to the parents. I always say, please vaccinate. These are the reasons why the parents are hesitant for the vaccine. The major cause most of the time where is the 20% of cases vaccine is too new and maybe worried of side effects, just do not want to get the vaccine. Maybe they prefer to have the virus and the long virus syndrome after the infection of their children. Maybe a very odd way of thinking. Exploring vaccine hesitancy. Let us discuss some of the reasons for the hesitancy. The vaccine can affect my DNA. They will put a chip inside our body and it will enter and they will control us and they will monitor us through monitors in USA. Hey, what happened? We are not that important to trace us through chips. Vaccine is an RNA. RNA is outside that nucleus. It is not inside the nucleus. Please remember this sentence. It is an RNA. You will see. The second myth, a vaccine developed so quickly and cannot be safe. You know, the most tracing method in history for a vaccine is going on now for coronavirus, especially in children. The vaccine can give me COVID-19. I will have the infection of COVID-19. It's ridiculous. Why it is false? The mild side effects associated with the vaccine is not the disease. It is a sign that you are reacting with the vaccine. What about the COVID-19 vaccine can affect my fertility? Wait and see till your child is married, or you are away from now. Why it's false? There is no data to suggest that these vaccines pose a risk to someone who is pregnant or wants to become pregnant. I don't need the vaccine because it is, I have already had COVID-19. COVID-19 is very good for primary immune response, but secondary immune response, which is through to helper 1, which will lead to improvement in the number of antibodies, beta cells, antibodies will occur with the vaccine. Why? You think why we are making antibodies with the vaccine and not with the original disease? Because the original disease is not immunogenic. They are adding adjuvants and many other materials with the vaccine to induce antibody formation. I don't need the vaccine because I am young and healthy. Why it's false? Even this is through the WHO, by the way. Even mild COVID-19 can cause uncomfortable and or lingering symptoms. Plus, even those who are young and healthy must be vaccinated to achieve herd immunity. I don't need to wear a mask after being vaccinated. Unfortunately, we have to, by law. Now, the benefits of vaccinating your child. Benefits are vaccinating your child. Because spreading of COVID-19 is mainly by the little angels. They are not symptomatizing, running everywhere, going to their grandparents and spreading the infection. Safety of the vaccine is still not yet proved. The vaccines are safe for children from 5 to 11. Clinical trials were conducted with thousands of children and no serious safety concerns were identified. What is the most important disease or side effect most parents are mentioning? What is the most important? The heart, myocarditis, cardiomyopathy, and Guillain-Barré. Let us see them. What about Guillain-Barré? So this is myocarditis first. The reported rate appears to be highest in those under 25 years of age. Onset is within a few days of vaccination, and most cases are mild and have recovered without any sequelae, just simple analgesics. I had 2 patients with these signs, and just simple analgesics, they were okay. Myocarditis is extremely, extremely rare after the first dose of the vaccine. If it happens, it will happen after the second dose. Those who develop myocarditis or pericarditis following the first COVID-19 vaccination should be assessed by an appropriate clinician to prove that that was due to the vaccine, not another virus infection. What about the Guillain-Barré syndrome? Very, very rare. 5 in 1 million. Prior diagnosis of Guillain-Barré syndrome does not predispose to further episodes. The balance of risk-benefit is in favor of completing a full COVID-19 vaccination schedule. To complete the course as using an alternative product may increase the chance of experiencing known side effects. What about the ingredients of the vaccine? What about the ingredients of the vaccine? As you know, there is what is called thimerosal. Thimerosal is a mercury-containing compound which was incriminated as a cause of autism in MMR. In Europe, maybe from 60 in the last century, from 1960 to 1970, there is an increased number of autism in Europe. That's why they prevented the use of MMR vaccine in Europe because of this claim. What happened after a few years? Many children died of measles, and the incidence of autism did not change. So it is just a rumor. Yes. Just عشان المحامين يكسبوا فلوس. It does not contain thimerosal. Okay, even if you are afraid from thimerosal, this vaccination does not contain thimerosal. But none of the vaccine contain egg, gelatin, latex, or preservatives. All COVID-19 vaccines are free from metals such as iron, nickel, cobalt, lithium, and others. There are also from manufactured products such as microelectronics, but it contains polyethylene glycol. What is polyethylene glycol? Very, very important material to improve viscosity. It is used mainly in creams, cosmetics, and laxative. You know what is the name of the laxative in the market, and we use it every day for our patients and containing polyethylene glycol? Movicol. Yes, Movicol. or Miralax. يعني أنا عن نفسي بفضل يجيبوا من iHerb Miralax. It contains polyethylene glycol. It's very, very well known that it antioxidizes and polluting the water and everywhere, and one of the reasons for damage of the ozone layer. That's what's said. Also, it is said that polyethylene glycol causes severe form of hypersensitivity. One of the questions in the Pfizer BioNTech vaccine of children, the same one which is given in adults, it's the same one? It is the same vial, it's the same constituents, the same ingredients, the same concentration. You know, if you give a small dose of the adult vaccine, is it okay to give it to children? You will see. Children aged 5 to 11 receive an age-appropriate dose of Pfizer BioNTech vaccine. Pfizer BioNTech vaccine for children aged from 5 to 11 has the same active ingredient as the original vaccine given to adults. However, the vaccine for children comes in a different vial with a different color cap. The Pfizer BioNTech vaccine that is given to adults and adolescents cannot be used, I'm repeating again, it is according to CDC, cannot be used for children ages from 5 through 11 years. Here is the, you know what's his name? والله أنا قعدت عشان أنطقها فترة وبعد كده اكتشفت إن الإن silent. Comirnaty vaccine. Co coming from COVID, Myrna, but the N will not be pronounced. From messenger RNA and T, maybe combination of community and immunity, and eligibility is based on the child birthday. No other contraindication. What about should children receive COVID booster dose shots? we have to know what is the priming dose and what is the booster dose. Priming dose are 2 doses. One now and another one after 3 weeks. What about the booster dose is what we have received as a 3rd dose. This is called a booster, first booster dose. Till now, it is no, I doubt. There will be. What about, does a patient have to give, parents have to give a consent for his children before giving the vaccine? No. In USA, there is no federal legal requirements for a parent, guardian, or caregiver to consent for prior COVID because they are dealing with the vaccine as an ordinary childhood vaccine. Children can safely receive other vaccines the same day COVID-19 vaccine is given. Maybe if you are not a pediatrician, you don't know when I have to postpone or separate between the 2 vaccines. If the vaccine is a live vaccine, like measles vaccine, MMR vaccine, BCG vaccine, oral polio vaccine, which is used nowadays in mass vaccination, all of them are live vaccines. If you are going to give 2 live vaccines, there must be 1 month apart. So a mother is coming to me, Doctora, I have vaccinated my child for 6 months now, and oral polio, can I give it to him today? If he is receiving 1 of the live vaccine, she received at 6 months BCG. I can give in the same day live vaccine, but not after 1 week or 2 weeks. I have to wait 1 month between 2 live vaccine. Must be given in the same day, or I have to wait 1 month. Here, the same idea is not applied here because it is not a live vaccine. The COVID vaccine can be given on the same day and time as the other vaccine, including flu and any other vaccine. Just think, this vaccine is a live vaccine or not. If it is live, we have to wait for 1 month. If it is not a live vaccine, you can give it at any time. Children who have already had COVID-19 should still get the vaccine. CDC recommends after elapse of their quarantine, they can receive the vaccine.
10 days is enough, no problem? 10 days from the beginning?
Yes. CDC recommends that COVID-19 vaccination for every age group 5 years and older, including those who have already had COVID-19. Emerging evidence indicates that people get better protection by being fully vaccinated compared with having just been infected with COVID-19, as we mentioned before. What about the contraindications of COVID-19? As we mentioned before, the hypersensitivity of any of the elements. And the second one, I have to make sure that I'm not sensitive to polyethylene glycol. What about patients with asthma? Should I give them the vaccine? Yes, sure. We have to give them the vaccine. What about immune-compromised patients? I have to give them the vaccine, and it is the same like immune-competent babies? No, they are not like them. What is the difference? I have to add 1 more dose. 1 more dose. So they have to receive a booster dose, not only the priming doses we mentioned before. How does the vaccination affect the risk of long COVID? As I mentioned before, it is thought that the persistence of the antigen of the virus after its clearance in the children's gastrointestinal tract is the cause of the subacute inflammation and immune stimulation, and is the cause of COVID-19 symptoms, what is called long COVID. If you are vaccinated or the child is vaccinated, the antibody reaction will be able to remove these remnants and get rid of them and much improve the symptoms. Here are the strategies we have to follow for protection of the children. And I want to mention something about Florona. Florona is the combined virus infection from corona and influenza virus. It is just a combination. Sometimes they said it is protective. One of them the antibodies of one of them is protecting against the other. So it is not strange to find positive corona and positive influenza virus. Omicron is not the last variant, and we will see others, yes, unfortunately, and there is an emerging one. It's exactly like corona, but with loss of smell. Here is a new mutation appearing in Botswana and starting to spread worldwide, exactly like the stupid Omicron, and we will hear about it later. And maybe it will be a VOC again, like Omicron. But all the data are confirming that Omicron is the weakest of them and cause mild disease, nothing to worry about. Smile, life is good, and the next day will be much better. I will repeat again, we will follow the distancing, social distancing, together with wearing masks, washing your hands, and cuffing in the bend of your elbow. This will be more than enough. And thank you very much for your attendance.
بخصوص البوست سندروم، بوست روبرت سندروم، المده بتاعتها يعني اكسبكت قد ايه؟ ده اول. ثانيا، امتى اقول للمريض يراجعني لو الكومبلين استمرت فتره طويله؟ وايه التريتمنت بتاعها بالنسبه لي انا لو جالي مريض؟ ده السؤال الاول. السؤال الثاني بخصوص السيمبتومز اللي بتبان بعد التطعيم، احنا قلنا مايوكاردايتس، بريكاردايتس او برايمري. ايه السيمبتومز والساينز يعني الاب والام يقلقوا من ناحيتها، من ناحيه البريكاردايتس او المايوكاردايتس، يجي يقول لي انا بشتكي من ايه؟ عشان انا الانسان يقول لا تراجعني لو لقى اعراض ظهرت بعد التطعيم. يعني معظم الناس بيسخنوا مثلا، اطفال بيسخنوا بندي مسكن، لكن ايه الشكوى اللي اقول لا تراجعني ما استناش بعد ما خدت التطعيم؟ وبرضه ايه المنهج بتاعها سواء كان بريكاردايتس او الجلومبري.
Okay. We start with the first question, which was, what about the post-COVID syndrome? Post-COVID syndrome is vague till now. We don't know any details about it, and many research are working while we are talking now, trying to know what is behind the theory of post-COVID. There are no investigations, no clue for specific diagnosis. More than one doctor is needed to diagnose it and sign if the child is going to have a report about his case if he has COVID and post-COVID syndrome, because in USA you can skip the exams if you have post-COVID syndrome without investigations and without positive PCR. For how long? We started after 3 months of infection. When will improve? We don't know. Like chronic fatigue syndrome, multivitamin, behavioral, psychiatric consultation, that's all we need. And yoga. They said yoga. Nothing, just multivitamins. And a second question, what about the side effect of the vaccination? From the first dose, I have to stress on certain things to the parents. This vaccine is like any other vaccine, but with less side effects. As we know, the dose is only 10 microgram, not 30 like adults. And at the same time, this 10 microgram, the side effects will be much less. The ingredients are much less. That's why they are preventing adult vaccination to be given to children, because it is well calculated the amount of the ingredients with the active part of RNA. So stress that it most likely, even if you are sure, most likely it is not from the vaccine, but we have to make your investigations and make sure that your patient is okay. And if he has chest pain and you do ECG and cardiac enzymes together with chest X-ray, if you want to do it, just simple analgesics. It will go away within 5 days.